Eczema is something which needs to be controlled, or else it will start to control you. If you've ever experienced the burning itch, the inflamed skin, the sleepless nights, then you know how eczema can disrupt your life. And if it worsens, eczema can dictate what you wear, how you feel, and even where you go. It affects your self-esteem, your relationships, and your emotional well-being. And before you know it, eczema can creep up on you and start to take over your life. So there are many types of eczema, but in this video, we're going to talk about the most common type, atopic eczema, where it affects millions of people worldwide. In the UK, 1 in 10 adults have atopic eczema, including myself. Unfortunately, there is no magical cream or tablet that will get rid of eczema forever. It is a chronic condition where you can have good days and bad days, which means some days you get eczema flaring up and some days you have no eczema. But on the days where eczema does flare up, it's super important to manage and control your eczema, or else it will get worse. So in this video, we're going to go through how you can get free of eczema's control, more specifically, why you get eczema, what you can do to help control your eczema, and what we as dermatologists can do for you to help treat your eczema. Hi, my name is Dr.ErmaDerma and I'm a dermatologist. So let's go. Okay, so what is atopic eczema? So knowledge is power. The first step in treating your eczema is knowing what is atopic eczema. So this type of eczema can occur in any age, but usually occurs in childhood. Children who grow out of their eczema can have eczema again later on in life. Atopic eczema usually presents as itchy, dry skin, sometimes getting weepy and sore on most commonly the areas such as your elbow creases, behind your neck, and behind your knees. Skin of color patients can present with on the knees or on the elbows. However, this can vary person to person, and sometimes eczema can get so severe it can affect your whole body. Atopic eczema is commonly associated with other allergic conditions such as asthma or hay fever. Okay, but why do you get eczema? It's a combination of factors such as genetics. So if eczema, asthma, or hay fever runs in a family, you're more likely to get eczema, specifically atopic eczema. Other factors are your immune system, environmental factors, and your skin microbiome. But to further understand this, it's best to demonstrate this using blocks. These blocks represent your outer layer of the skin. In normal skin, your skin barrier looks like this. Your skin surface cells are nice and neatly compacted and nicely aligned together. And it's all because of a gene called filaggrin, which causes your skin surface cells to bundle and stick together through tiny cell threads in between your skin surface cells. When these threads come together, they make a strong structure. These cells stick together really well and create a strong barrier that stops water from getting out and keeps harmful stuff like germs, or allergens, or outside irritation from getting in. The problem is with eczema, more than 50% of these people have faulty filaggrin gene, which causes your skin cells not to line up properly, and your skin loses its natural moisturizers. And this means any allergens such as dust or germs can get through the weakened skin barrier. And on top of this, people with eczema have an excessive immune system response to harmless microbiomes and allergens, which causes the inflammation to worsen. And then you start to scratch, which worsens the skin barrier and breaks your skin, and this causes more inflammation and then causes more itching. And this causes such a vicious cycle, which causes your skin barrier to look like this. A bit of a mess and skin that needs help. Okay, so what can you do about you controlling your eczema? So there's not much that you can do with your genetics and ethnicity. However, there are 8 things which you can control to manage your eczema. I have to add, this is not a substitution for your prescribed eczema treatments, but it is lifestyle changes that you can do to help minimize and control your flares of eczema alongside your eczema treatments if needed. So number 1, skincare. Maintaining your skin barrier is super important for eczema. To help this, you want to use a hydrating and moisturizing skincare products even when your skin is calm and controlled, since supporting your skin barrier makes it much less likely for flare-ups to occur. And you want to moisturize as many times in a day as possible, minimum once a day, Moisturizers help support your skin barrier control because it fills in and binds the gap between your surface skin cells. The greasier the better, but use the moisturizer that you are able to tolerate multiple times a day. Apply your moisturizer in the direction of hair growth. When you do go in the bath or a shower, make sure you wash with lukewarm water, since hot water can cause more water loss from your skin. And try not to take long baths, since again it can dry out your skin. So you want to use a soap substitute for cleansing your skin, such as Hydromol ointment or Dermal 500. If you have hand eczema, you can wash with Dermal 500 because this kills COVID as well. Some ingredients to look out for when using moisturizers or cleansing products are ceramides, colloidal oat if you don't have an oat allergy, glycerin, petrolatum, or liquid paraffin. And you want to avoid products which have fragrances and preservatives. Some ingredients to look out for is sodium laurate sulfate, lanolin, and ethanol. Natural products and essential oils can cause irritation and sometimes allergic reactions to skin. So stay away from nut and seed oil, limonene, and linalool. Number 2, stress. Now, stress releases cortisol, and cortisol has shown to weaken your skin barrier and become more vulnerable to inflammation, irritation, and infection. Especially if you have eczema. You already have a weakened skin barrier and this exacerbates it further. Cortisol also increases your inflammatory pathway, thus worsening inflammation. So it's so important to help stress levels, and I understand it's easier said than done. Some ways in reducing stress is mindfulness and meditation, and you can find some great videos on YouTube on meditation, and one great app is Headspace. Journaling is also a great way to untangle your stress and emotions. But please visit a health professional such as a therapist to help with your mental health. So number 3, clothes. Clothes can also cause eczema to worsen. So you want to avoid large fiber wool, synthetic materials such as nylon and polyester, since this can cause overheating, irritation, sweating, and leads to itching. So you want to opt for fine merino wool, silk, bamboo fabric, because studies have shown that this will not worsen eczema. However, the best is 100% cotton, which is soft, cool, breathable, and absorbs sweat. Number 4, the climate. So during winter, when it gets cold and when we put heating in homes, the humidity drops. So this can cause more water loss from skin and worsening of eczema. Some dermatologists recommend humidifiers, but honestly, the evidence is mixed for this, and more studies are needed to see if humidifiers make an impact on our eczema. If it works for you, then great, but I would advise to moisturize as much as possible during the winter months and keep your eczema treatment optimized. So number 5, hormones. Eczema can flare up before the menstrual cycle and during or after pregnancy or around menopause. However, we need more studies on hormones and eczema, as well as the role of hormone replacement therapy in menopause and if this affects eczema. Again, I would advise to moisturize as much as possible and keep eczema treatment optimized. Number 6, household irritants. So eczema can result from various household factors, and individuals with eczema typically have multiple triggers. It's crucial to understand that numerous common household irritants like house dust mites, pollen, pet hairs can't be entirely eliminated or completely avoided. So don't worry, I'm not advising you to kick your dog out or your pet out, because you should try to minimize this as much as possible. For example, get a vacuum or a hoover that could hoover up pet hairs that could actually help your eczema. But managing your triggers should complement, not replace, your eczema treatment. And number 7, vitamin D. Vitamin D is crucial for strong bones, a healthy immune system, and may help with eczema. You can get it from sunlight and food. Some studies suggest low vitamin D might be linked to eczema, and supplements could improve symptoms. You can ask for a vitamin D blood test, and if your levels are low, prescription vitamin D is available. And number 8, diet. In terms of what food you should eat to help your eczema, first of all, eat a well-balanced, healthy diet. However, there are some foods that are anti-inflammatory and can help eczema-prone skin. So try to eat oily fish twice a week. This contains omega-3 essential fatty acids, which helps form the protective skin barrier. Apples, broccoli, and green tea. These foods contain an antioxidant called quercetin, which helps reduce inflammation. Eating a variety of plants of over 30 per week. This helps support gut health. This can also include nuts, seeds, spices, coffee, tea, herbs, and plain chocolate. The other is avocado, which is a healthy fat which again supports your skin barrier, and probiotic food. In some studies, imbalances in your gut bacteria has been linked to eczema, and probiotics can help support beneficial bacteria. So try to include probiotic foods such as kefir, kimchi, or live yogurt on a regular basis. Just to add, in terms of gut microbiomes affecting your eczema and whether you should take probiotics or not, there's still research needed for this. But if you wish to try a probiotic to see if it helps your eczema, then you can try Lactobacillus rhamnosus GG for 3 months, in addition in having a healthy and well-balanced diet to see if there is any improvements. Going along the theme of diet and food, one common question that I get asked a lot: is my diet triggering my eczema, and does this mean I have a food allergy or a food intolerance? Here are 4 points to bear in mind about this. So number 1, it's totally possible in having a food allergy and having eczema. Number 2, it is totally possible in having eczema and not having a food allergy. Number 3, and although food allergies do not cause eczema in adults, they can trigger flare-ups. Number 4, the more severe the eczema, the higher the risk of developing food allergies, and hence why keeping eczema under control is so important. So when we talk about food allergies, there are 2 types that we need to broadly categorize, which is the immediate type and the delayed reaction. With the immediate reaction, you can go into anaphylactic shock, which is a severe life-threatening reaction in where your airways get swollen up, where you can't breathe, and your blood pressure drops. Other immediate types of reactions are hives or urticaria, worsening of your eczema, itching, and stomach upsets. This type of reaction can occur whether your eczema is controlled or not. This is not a feature of eczema, this is a true allergic condition. A delayed reaction can take around 48 hours to appear. The delayed reaction can cause a flare-up of your eczema. These types of reactions can be difficult to identify since you have to go through all that you have eaten within that time period and see what you reacted to, and sometimes the response of your eczema can vary. So sometimes it can be very severe, other times it can be mild towards the same food trigger. Unfortunately, there are no useful tests to identify a potential food allergen. However, what we recommend is to keep a food diary and write down what you have eaten in specific time periods, usually a 2-week time period. Identify foods that are associated with flare-ups of your eczema, and then go to an allergy specialist or a dietitian, and under their supervision, eliminate food that has been associated with your flare-ups of your eczema. And then wait for 4 to 6 weeks to see if your eczema improves. And then gradually incorporate these foods one at a time and see if your eczema flares. However, I need to stress, please do this under supervision of your nutritionist or an allergy specialist, since you may get nutritionally deficient, especially if you are cutting out multiple food groups, which is not healthy for your skin barrier and overall health and immune system. But also you may delay in seeking treatments for your eczema and cause worsening of your eczema. If you'd like further information on diet and eczema, then I heavily recommend this book, Skin Food by Dr. Marutapu. She's a consultant dermatologist and a nutritionist. She has written such expert advice on the holistic side of skin conditions and gone into details about food, allergies, and eczema in chapter 6, where she has broken down this complex topic in such simple, easy to read, and yet in such a detailed and informative way. Basically, I'm impressed. I highly recommend it. I'll put a link in the description box below if you would like to purchase this book yourself. Okay, so what can we as dermatologists can do for your eczema? So the first mainstay of treatment is topical treatments. So one topical treatment is topical steroids. Topical steroids helps calm down your inflammation of your eczema and relieves it. There are many different strengths for topical steroids, and it ranges from mild to very potent. There has been fear around topical steroids, but topical steroids are safe to apply when done under supervision and prescription guidance. It's usually prescribed once daily or twice a day, like morning and evening, for 2 to 4 weeks or until the eczema is cleared. When dealing with eczema flare-ups, you can use a topical steroid cream at any time during the day, but it's best to apply it after a bath or shower when your skin is slightly moist. Pat your skin dry gently with a soft towel, then put the steroid on the red or irritated areas of your skin. After waiting for 30 minutes, you should apply a moisturizer to your entire body. This 10 to 30 minute gap helps prevent the steroid from mixing with the moisturizer and spreading to unaffected areas. And you want to use clean hands to apply a thin layer of the steroid cream until your skin appears shiny. And to apply topical steroids, you want to use the fingertip unit method. To determine the right amount, there are guidelines based on the fingertip unit, which is the amount of cream that covers the tip of an adult finger from the tip to the first joint crease when squeezed from a tube nozzle. For different body parts affected by eczema, you may need different amounts of the steroid. So for the face, you want 2.5 fingertip units, arm and hands 4, leg and foot 8, chest and stomach 7, back and bottom 7. After finishing your treatment course, dispose of any unused steroid cream or ointment and remember to wash your hands after applying the steroid unless you're using it to treat your hand eczema. There are non-steroidal creams as well if steroids are a concern for you, such as topical tacrolimus or pimecrolimus, but please discuss this with your dermatologist. The other treatment is phototherapy. Now, this is like medical light therapy that treats your eczema with specific wavelengths of light. You would usually need to attend a phototherapy 3 times a week for usually a period of 3 months or longer. And then we have systemic medications. Now, systemic medications for eczema are typically reserved for severe cases that do not respond to other treatments. These medications are used when eczema significantly impacts the person's quality of life and is difficult to control with topical treatments alone. These medications will need to be monitored for side effects and regular blood tests are needed. And then we have the specialized treatments such as biologics. Now, biologics are designed to target specific molecules or pathways in the body, often related to the immune system or other biological processes to treat various medical conditions. For eczema, it usually blocks the inflammatory pathway that causes eczema. These are usually given as injections. In the NHS, you need to have failed 2 systemic medications to be eligible for a biologic. And then we have the new treatments called the Janus kinase inhibitors or JAK inhibitors. These are the new and specialized treatments for eczema. They are a class of medications used in the treatment of various inflammatory and autoimmune conditions, including moderate to severe atopic eczema. These medications work by inhibiting the activity of specific enzymes called Janus kinases, which are involved in the signaling pathways of the immune system. By blocking these enzymes, JAK inhibitors help reduce inflammation and control the immune response in eczema. Okay, so the good news is that yes, you can control your eczema, and in reality, you have control over your own skin. So hopefully this information will give you a happier, healthier, eczema-free skin. And if you're Muslim, you're more likely to get dry, irritated, and eczematous skin. Find out why here and how to avoid it and treat this on this video.